Good morning, all. I am Dr. Yusuf Kumble, a cardiologist by profession and fortunate to become an healthcare provider. I want to share a story that highlights not just the incredible science of medicine, but the art of decision making, life saving decision making in critical moments. It starts with an almost impossible task and ends with miraculous recovery. And it is a real life example how the right decision making the right time can defy the odds. It was a routine evening. I got a call from an emergency room. A 75-year-old lady was rushed to the emergency room. She was brought dead as per the medical terminology. There was no pulse, no BP, and no respiration. Our emergency team was already trying to revive her. They continued cardiopulmonary resuscitation and they intubated her. Within long effort, about 15 minutes effort, they could revive her. And I can see the sign of life coming into ECG and BP is coming up and she's already revived. But it's a complex scenario. I explained to the patient relatives, the beloved one had a massive cardiac arrest, myocardial infarction, and she is revived by our emergency team. But we don't know whether the brain is dead or not. She is still unconscious. We don't know the time lapsed between the cardiac arrest and the revival time. She had a cardiac arrest outside the hospital. If it is a prolonged time, she may not recover at all, and there is a chance of recovery. However, we know only after 72 hours. And there was a sigh of relief when I explained the relatives that the patient is revived. But I continued that this patient needs an emergency surgery that is called angioplasty. I have to remove the block, I have to put an implant stent, and I have to implant a pacemaker also. Time is very crucial, only 60 minutes you have. I can't go beyond that. She may die if we do not act quickly. Obviously, the patient relatives are in more confusion. They were shocked. And after a lot of discussion, they agreed. They signed the informed consent. And our counselor counseled about the complexity of the scenario and the outcome and the financial implications. We have taken the patient into the cath lab. Within 1 hour, we have completed the procedure. And I came out of the cath lab and explained to the relatives how we removed the block, how we implanted the stent, how we implanted the pacemaker. And the patient, that patient party was fully explained on the computer. It was like a victory. But I know the journey was just starting. Patient is still unconscious, patient is shifted to ICU, and the patient not showing any signs of recovery in the brain. Days passed, there was no signs of recovery. Every day, morning and evening, I explained to the patient party, we are trying our level best. Heart is completely stabilized. She is picking up, BP is normal, everything is normal, but we don't know the brain is, she will recover or not. I prepared them to the worst. As expected, she had all the complications. Within few days, she had a renal failure, she had sepsis, she had all the other complications. With the team effort, at the end of 2 weeks, she started showing signs of recovery. I can see the overzealous happiness and the feelings, emotions in the family's eyes. They were so happy. And after 4 weeks of ICU stay, she walked out of ICU without any deficit. And there's a deeper lesson in this incident, because this patient, if we had not taken a decision at the right time and the right decision, we would have lost her. So doctors, we are not luxurious enough to see the hindsight. We take decision in an emergency basis, in real-time basis, under extreme pressure. We know the limitations, but we take this decision for the best, thinking the best outcome of the patient. Many a times we are having some limitations, and we put the patient's outcome is the first, and our experience, our expertise, and our commitment. These things we put full-heartedly, wholeheartedly to come out, to get the best result. At the time of discharge, the patient's relatives were in tears. I can see the emotions in their tears and the happiness in the tears. But for my surprise, they apologized me. They told me that they're thinking this patient was already dead. Every day they come to the ICU, patient is on ventilator, no response, look like a dead body. And day 1, day 2, day 3, day 7, day 10, and day 14, she's not opened her eyes. So they thought this all exercise is on a dead body. And I was in shock. The whole 2 weeks, every night I was thinking whether she will make it or will she not. But I could never read the relative's mind. They were thinking something entirely different. Especially the bill was piling up, and their thought process also became deviated. I can tell another story of another patient, which on routine examination he was found to have a small hole in the heart. That is, we call ASD, atrial septal defect. I explained it is a very simple procedure. We have to close this. But the patient was reluctant. He's a 40-year-old man. He said, I do everything, doctor. I don't have any symptoms. I was never aware of this problem I had. It is a congenital problem by birth. Why should I do it? Then I also got confused whether to do, to not to do. I referred to a senior cardiologist. And he explained him, and he convinced him that it is a one-day procedure. Come to the hospital, get admitted. No surgery, no anesthesia, no pain. You just do the procedure. Within 24 hours, you will be discharged. Patient got admitted. The procedure started. I assisted the procedure. During the procedure, something has happened. Air is sucked into the heart. Very, very rare complications. Very, very, very rare complications. And the air is from heart, it went into brain. And the patient went into coma. A 40-year-old gentleman came to the hospital walking and went into coma. And with all our expertise, neurology team, neurointervention, cardiologists, everybody, they did all the effort to suck out the air from the brain, but miserably failed. And we brought back the patient on the coma state to the ICU, expecting that she may recover. We know that very remote chance of recovering. Explained to the relatives, and days passed, not recovered. I can see the patient party, the small kids, and young wife, and elderly mother is waiting outside the ICU, thinking that he will come out walking, but it never happened. And when the bill is piling up, the patient is shifted to a government hospital. I was shattered. Am I taking the right decision? Am I correctly advised? We have all the technology, we have excellent doctors, but in spite of that, we couldn't make him. These type of incidents made me to think how to revolutionize the healthcare, how to change my practice. Nowadays, these corporate hospitals are having a corporate culture. The high-end technology and the highly salaried doctors and staff, and they talk always the business model. The so-called CEO and COO talk about the business model. There was a time in India, something called nursing homes. The doctors, nurses, they know their patients. They take care of the patients with the love, passion, and compassion, and tender, loving care. That is not there in the modern hospitals. And when these type of doctors treat their patients, the community trusted their doctors implicitly, which is now an extinct entity. So I want to re-establish this bond between the doctors and the patient and the society. So I thought of combining this newer technology with the human compassion with an affordable rate. So I thought of three things. First thing is how to make a strong bond between the doctor and the patient. In our medical school, we were taught like you have to speak to the patient. Nowadays, no doctors speak to the patient. You have to speak to the patient. It's not just speaking. You have to spend at least 15 to 20 minutes only speaking, not touching the patient. Only speaking. What you speak? Speak what is the complaint, what is the history, what is the personal background, what are the habits he is having, when he was born, what is the type of friendship or habits he is having, and what is the drug history, what is the personal history. All these things part of our curriculum, but nobody is practicing that. There is the place you lost the bond between the doctor and patient. When you have done this, half battle is won. Patient is already half battle is won. This is the one I want to practice. My doctors should practice this. Second one, that is awareness. Most of the people are not interested in knowing about the health. So you have to make an awareness about the health. And if I ask somebody what car they want to buy, they know. They do research on that. But nobody do research on if I get a disease, what should I do? Where the money come from? All the diseases are not surprise. It is everybody. Today me and tomorrow you. It's going to happen to everyone. Those who are born are bound to die. Those who are bound to die, bound to have disease. It should not be a surprise. So I started making awareness among the society, the type of diseases, the type of complications, the cost involved, the limitations of the science, the outcome of the treatment. Everything patient should know. And lastly, there should not be a one-time treatment or one-size treatment for every diseases. It should be patient-based, genetic-based, or community-based. And you cannot treat for all same disease for different people. You should have a different approach. Especially, you cannot follow the blind guidelines of American Heart Association or European Society of Cardiology. So, I've been fortunate enough over the last 20 years of experience. I've been fortunate enough to merge my expertise in healthcare with a strong sense of business acumen and philanthropy. I use this combination to connect and to build a legacy that goes beyond treating the mere illness. It goes to the well-being of the society. So I started establishing a hospital, a corporate hospital. I started in 2011, Indiana Hospital and Art Institute, where it is a corporate hospital with high-end technology, but it is a culture. I was changing to make a nursing home culture with a well-equipped doctors and well-trained nurses, but the culture I wanted to change. Instead of CEO and CO, I made the doctors as an ambassador of the hospital. I made public to contribute a small share in the hospital. I made social workers to involve in the decision making. I made the staff to make them the family members. I made more meetings, not the business development, but the patient care, and less business development meetings. So I made, for the poor people, I made all the government schemes available so that the high-end technology and the high-end treatment should be available for all sections of the society. To conclude, my passion was to become a cardiologist. On my journey, I have seen many hurdles. I overcome these hurdles by becoming an entrepreneur now, along with my cardiologist. My entrepreneurship was not my passion, but it was accidental. But this was an opportunity for me. And for you also, when you have a journey towards your goal, towards your passion, there may be unseen opportunities that may be better than your real goal. And ladies and gentlemen, when in your journey, the important goal should be is not how much you gain in your journey, how much society gained in your journey. Thank you very much.